Hi, my name is Katie Rowe. I'm a licensed mental health counselor located here in Tequesta, Florida. And I just wanted to talk to you real quickly today about anxiety in children. A lot of times anxiety can actually be mistaken for as a behavior problem when it could actually be anxiety manifesting itself as behavior problem. So I wanted to talk to you real quickly about some of the symptoms so that you might be able to notice it or spot it more easily if in fact any of your children are experiencing anxiety. So three main things I would encourage you to look out for would be physical symptoms, emotional symptoms, and behavioral symptoms. So some of the physical symptoms might be sick to their stomach. I know with the FSA, a lot of times kids actually do vomit when they're approaching taking that exam. Um, Other things, chest pain, can't fall asleep, shortness of breath, sometimes panic or other like symptoms. And then on the emotional side, sometimes crying and tantrums and anger and meltdowns are actually signs of anxiety, especially if the child is going through any type of transition, whether they just moved, whether there's been a divorce or a separation in the family, or something related to the family dynamic has changed or shifted, the birth of a new child. Sometimes those can also trigger anxiety, which manifests itself as anger and tantrums. Sometimes they can also experience a fear of going somewhere, which might actually be the beginnings of a phobia, or a fear of something or someone else. And then the behaviors might actually involve becoming more withdrawn, isolated, nail biting, picking, or other OCD like behaviors, checking doors, checking locks pretty often. So I would encourage you to look out for some of these symptoms, and some of these things can be treated fine, no problem at home by helping your child learn coping mechanisms, helping them to take a time out to calm down, take a deep breath. But if you find that some of those coping mechanisms are not helping your child, then you might want to look into getting some extra help with a therapist, psychiatrist, psychologist. So again, just wanted to give you some symptoms so you are aware of what to look out for if in fact your child is experiencing anxiety.